Great answer, David. And I understand this is a complex area, but people need to take away from fairly simple bottom line deals to say what adjustment can they make. So one of the questions that people have is if they start feeling bad, and it's hard to contact your doctor, at what point do you pick up the telephone and call an ambulance or get somebody to drive you to the hospital? At what point does it get serious enough you say, I'm not feeling good and I think I may have COVID? Because it takes 5 days to get a test nowadays.
Right. Well, I think a lot of what we know about influenza, I think is fair to apply to this, as well as for any other respiratory infection as well. Obviously, we know that there are more people perishing from this than the flu, but there's certainly some commonalities to respiratory diseases. So what are the things that would be the most concerning? Would be difficulty breathing. Not just the cough that's there, but like you're having difficulty catching your breath. You're really struggling. Hopefully you get this identified before you get into that. Okay. But also recognizing that, there's the two phases of COVID. There's the first phase, which is more flu-like illness. And then there's that second stage, which is when the cytokine storm kicks in. And that's what goes into the really tragic types of stuff. Okay. Now that transition can happen very quickly over the course of 24 hours, but there are these two phases, and knowing which of those two phases that you're in is important. And that's why it's important to be in contact with a healthcare provider. We've heard one of the things that is successful for stopping the bad disease is dexamethasone, which is a form of steroid. Now, you don't want to give that at the very beginning of the illness because you're going to suppress your immune system and won't be able to fight off that initial fight against the virus. It's the secondary cytokine storm. That's when we want to push back with the steroids or other natural anti-inflammatories, which I do a lot of that stuff as well. So knowing what phase of the disease you're in is also going to target how you should tackle it. Now, if you just feel a little achy, if you're like, okay, I'm keeping fluids down, maybe I don't have the greatest appetite in the world, but I'm staying hydrated, my urine output, I'm not making dark yellow urine unless you're taking B vitamins, but you're making the normal lighter yellow urine that you'd expect. So is there a change in the volume? If there's a change in the color, then that's a sign that you're maybe getting dehydrated, which again, can happen with the flu. Okay. And then there are people who can get more inflamed. So like if you're just feeling terrible, okay, it's good to check in. And again, to at least allow for that assessment. Okay. Of course, I would err on the side of being checked out or at least contacting a healthcare provider who can provide that type of information. Now, I realize that it's even scarier when we're hearing about the possibility that there might not be a hospital bed for us. I mean, that's the, we talked early on about bending the curve. And we did it. It was crazy in New York City, especially New Jersey. They were able to do the interventions needed societally to bend the curve so that we weren't running out of ICU beds. Now we hear in the Midwest, we hear that that's a big problem right now, is that they're just not going to be the beds and the doctors and the nurses to take care of people. So that's why the prevention mode is the absolute most critical. A colleague of mine, he was actually the head of virology, the American Virology Society, and is the head virologist at University of South Florida here in Tampa. He said a brilliant quote to me, which I say a lot. The only way that you can prevent getting COVID is to not be exposed to somebody who has COVID. Okay. And for all the people that we see out there who are not wearing masks or being in close quarters and all of those things, eating indoors with your mask off, sitting in the same room with other people for an hour, that is the worst thing that you could possibly be doing if you're really concerned about not getting COVID. So that's why, keep having the pod that's in your house. I'm not a bubble person. I don't stay in a bubble. I go out walking with friends. I'm on one side of the road and he's on the other side of the road and we go walking. I'm outside doing my exercises. When I'm riding my bike or I'm jogging, I'm not wearing a mask for sure. But if I'm going to go into Publix, of course I'm going to wear it. That's our supermarket here. If I'm going to, if I have to run into a store, well, I try not to as much. I mean, thank goodness for Amazon because our lives, for Amazon Prime, the best investment we all could have made. But the America, in my opinion, is going about this all wrong. But, the question shouldn't necessarily be, should I wear a mask or not? It's, should I be close enough to somebody that would require me to be a mask in the first place? And so those are just general concepts. I mean, and so I realize that we live in a politicized world and, where you tell you tell everybody that the sky is blue and half will say, no, it's red. And that's just the way the society we live in. It's very sad that masks became a political thing because it works. We know it doesn't hurt people. Oxygen levels don't drop. We tested it ourselves. I've been in operating rooms for 4-6 hours at a time. Neurosurgeons could do it for 12 hours. They're not having problems because of a mask, So it's really just a matter of also doing the smartest thing possible to not catch the disease.
Well, David, this is wonderful. I think it's answering a lot of questions, but I think the big takeaway is what you mentioned, and that is let's prevent it in the first place, either by not being around someone with COVID, or if we do happen to be exposed to it, how can we be the lucky ones that have no symptoms or mild symptoms? So I'm going to go to the screen share right now, and I'm going to bring up the protocol that you circulated to me. And I think from my experience in doing this, it's the best thing I've ever seen. It's really an incredibly good protocol. So I'm going to go after a couple of pages because everybody got this, David. And if they didn't, they can get a copy from me. But as we go through here, let's start with the daily supplements and strength of the immune system. You also mentioned great food and great sleep and great exercise, and each person can figure that out. But one of the most difficult things to do is how to figure out the levels of supplementation. So can you go through those and sort of highlight?
Sure.
Save
Let me see if I
time
can.
for questions.
Okay.
So,
Yeah.
and I think we will go to an hour 15, so we have some time for questions. But if you can run over this, that would be great, David.
Sure. So, okay. So first and foremost, what you're seeing in front of you are general recommendations if I didn't have the ability to test somebody. Okay. These numbers could be way off the mark. You see, it says adult 15. It took 5,000 units for the vitamin D, for instance. It took me 15,000 units to get my level up into 65, 70, which not coincidentally, I have not had any asthma. I had lifelong anaphylactic reactions to corn. I no longer do. And I'm absolutely convinced it's because I got my vitamin D level up. But I had to take it up to 15,000. I've now lowered it to 10,000. So while 5,000 is a very large amount for most people, if they don't know what they're talking about, that may not be enough. And so again, that's why checking your 25 hydroxy vitamin D level, that's the actual name of the test, and then getting your level up into at least the 50, 60 range, no matter how much it takes. Because at the end of the day, it's what your blood level is really what's going to be helping you, not just how much you're taking. But in general, I think that these are good, safe doses that we can be able to do for these various age groups that would certainly be safe and would certainly be better than not at all.
And David,
So,
you're mentioning the 50, that's nanograms over milliliters, just to give that a reference point.
That is correct. So the 50 is what I get people of, as I said, if they have chronic issues, I aim for 60 to 70, but 50 seems to be the sweet spot. When I started doing my research into this and developing the preconception protocol, this is the number that kept on coming up for me, levels than 50 for immune support, which I said is more than simple bone support.
Yeah. I think Fauci surprised everybody by saying that's one thing he does religiously to help him with COVID is vitamin D.
Yeah, well, and that's one of the really interesting things is that what I've been hearing coming out of people like Fauci and a lot of the university-based immunologists and epidemiologists is we're really singing a lot of the same song here, which is really nice to see that there is that kind of universality here about that. But yes, so the vitamin D would certainly be a great thing. Now, probiotics. Now, again, this comes back to the health of the gut. Now, actually, since I wrote this and over the summer, I actually spent a lot of time, and I know that Dave's very familiar with this, but the role of the microbiome, which is not just the good flora, but the nutrients around and the inflammation within the gut. I also very much am now focusing people on eating fermented foods, yogurts, kefirs, sauerkrauts, pickles, getting a wide variety of those foods. There is more flora, more cells of bacteria in a quarter teaspoon of sauerkraut juice, not even in the cabbage, but the juice, than almost any probiotic capsule that's on the market, just from a little sauerkraut juice. But each of these fermented foods have a predominant strain that it's grown in, so that's why you want to do a little variety as much as one can. But that, and again, things like prebiotics, we talk about what are called fructo-oligosaccharides. You hear inulin, Jerusalem artichoke. These help those good bacteria grow. So I am also of the belief that if a person does have a healthy diet rich in those types of foods, it's not necessary to be taking probiotics like this. But if it's not in the diet, then having a probiotic there just seems to make it very good in terms of balancing the gut better. And the other thing that we always want to look at with a probiotic is getting ones that have as many different strains as possible. So like an 8-strain probiotic, a 12-strain probiotic, the ones that are just like, there's a product called Culturelle. Great product for fighting back certain types of Clostridia, but it's only one type of lactobacillus. So I want to, if we're knocking out a bunch of them with an antibiotic, or we need a bunch of them to be there for the overall health, then we want to have as wide of a variety there as we move forward.
Okay, so we've gone through vitamin D. The recommendation is getting the levels up to 50 nanograms per milliliter, regardless of how much you take. And it may take more than 5,000, but over 5,000, you're not harming yourself.
As long as the levels stay, as long as the levels.
I'm very grateful, David, that I sold Kirkman a year ago, because I wouldn't want to package sauerkraut juice. So anyway, so okay, let's go to the next one then, and vitamin C.
Yeah, so we know, so vitamin C, we've all kind of historically, if there was ever a supplement that any of us had ever heard about going back to our childhood, was vitamin C. Okay, and so the amount, that should be 250. There's a space between the 25 and the 0 there, so that should be 250. I just realized that. So just it's a very powerful antioxidant. It helps support the immune system. And again, taking 500 to 1,000 milligrams a day is certainly a very good maintenance dose. Actually, if a person starts to get sick, you can actually start increasing your vitamin C. In fact, it's felt, since vitamin C, if you take too much of it, it actually serves as a laxative, stool softener. And it's felt that when you're sick, you can keep on taking more and more vitamin C up until the point your stool gets loose, then back it down. But up until that point, no matter how much you've taken, it's working for your body. You can't overdose. You cannot overdose oral vitamin C because you'll get diarrhea first. And you could inject too much of it. That would be one thing. It takes a lot to be injected, though. But oral, you really can't do anything harmful with that. Okay, and then when we were talking about zinc before, and you can see here our discussions about smaller for older and adults. Again, I have many people, it's taking 50 to 100 milligrams of zinc to get that level up around 100. So that's one of the things that we try to do. But also, one of the things that I've also very recently started focusing on when I'm checking blood levels for zinc. Most often blood levels are checking plasma or serum levels, what's floating around in the blood. Now, one of the things that came out of the COVID research is a risk factor for having more severe disease is low intracellular zinc. Not just what's floating around in the bloodstream, but what's getting into your cells, okay? Into your blood cells, into your lung cells, into your immune cells. So what I've started checking as well is what's called a red blood cell zinc. And that tells me that. And if that's low, but I did a plasma level and the plasma level's good, then the problem may be a transportation, not a supply issue. So do we have something that's going to bridge in order to get it in? We hear there's actually a concept of something called zinc ionophores. And one of the nutrients that has made its way into the COVID literature is quercetin. Quercetin facilitates getting zinc into the cells. And that's something that's now part of our soon to be, we are in the process of updating this document that you see, and I will certainly share it with David. We're about 2 weeks out, but we have a lot of updates coming to this. But quercetin is definitely part of that. If I'd put somebody on it, if we didn't know what the RBC levels, but we just say, hey, we're coming down to crunch time. We need to treat this COVID, prevent it. We got exposed. I would start taking quercetin to get the zinc into the cells in order to help fight the good fight.
Okay, I'll look for that and I'll update everybody on it.
Yeah.
Thank you, David. What about vitamin A?
So vitamin A. Now, people don't usually think about vitamin A from an immune perspective. We typically think of it more for our eyes, right? Carrots, bunny rabbits eat carrots, great vision. Well, this goes very early back into my career, good 20 plus years. A holistic pediatrician down in Miami who I spent some time with. He was the only guy I'd ever heard who was doing this besides me. And he pointed out to me that high dose vitamin A is the only known treatment in the world for measles. If you look at the World Health Organization data, at the CDC, the recommendations talk about a short course, i.e. 2 days, of high dose vitamin A. But then he said to me, but I've learned that this is not specific just to measles. I use it for all types of viral infections. And that became something, early thing that I adopted. And I will tell you, and both for adults and children, when we start this vitamin A blast, very often people are now talking to me about how sick they are in hours as opposed to days. I've absolutely seen with my own family that and that's why I tell people at the very first signs of illness, don't wait for 2, 3 symptoms. The first sneeze, the first cough, the first watery eye, the throat tickle, relative cough on you, and maybe it's coming. Start the vitamin A blast for 2 days right off the bat. Okay, and that's one of those things. And so here, these are doses for the vitamin A for the daily use, but then the vitamin A is also a 2-day blast that we do when you first start to get sick.
Okay, that's a great advice. And I've seen that in so many families with autism, the vitamin A treatment makes such a difference. And David helped pioneer that work in the special needs community. And now we have something that you're going to have to pronounce for us, David.
Arabinogalactam. Okay, we all say it together. Arabinogalactam. So, arabinogalactam is the active ingredient in echinacea, which again, one of the first things that we ever heard about, when anybody heard of probably the first herb for immune support anyone had heard of is probably echinacea. The active ingredient is called arabinogalactam. Now, the arabinogalactam is also found in the bark of the western larch tree. How on earth anybody would have figured this one out is beyond me. But it can be in a purified powder, much more potent per milligram than echinacea is, and it seems to be something that you can take long term. And what the arabinogalactam does is a general stimulator of white blood cell production. Okay, which is, again, white blood cells are what makes the antibodies and fights infections. Now, you do need to be a little cautious with arabinogalactam if you have an autoimmune disease, because since those are also produced by white blood cells, those antibodies, you just got to be a little cautious that you're not flaring it. I don't not give it. Right, double negative there. But I just caution people on that one because, again, we don't want to throw too much of the immune system. We don't want to make it too strong. We just, again, want to find that balance there. But the types of doses that are here shouldn't cause that problem. But again, I always have lots of nuance in any recommendation that I make.
Great, David. And that's a great explanation for it. Thank you. Wonderful. Let's go on then to the next one.
Absolutely. So elderberry. So elderberry first got its notoriety from its work against the flu. This was actually research that's been done decades ago in Israel, where they were able to show that elderberry, sambucus is the actual name of this syrup that you'll see also, has direct anti-influenza killing effects. And again, I started learning that it wasn't just for influenza. And so elderberry has been shown to kill other coronaviruses. Okay, obviously, so much of what we're doing it with coronavirus now, or the COVID-19, is we are extrapolating based upon our knowledge of other coronaviruses, which, as you probably know, up until now, and the SARS-1, and the MERS that didn't cross onto our shores, coronaviruses have always just been a typical childhood cold. Nothing more, nothing less. Nobody would ever test for it because no one was sick enough to get tested for it. Okay, but there is evidence that elderberry does knock back other coronaviruses. So this is something that I'm presuming, because at the end of the day, this is still a coronavirus. The same little spiky heads that the other ones is. This one's more virulent. So that's where. Now, the one thing about the elderberry, though, this is one you only want to do in prevention or at the very start of the virus. Elderberry, among these things, it does increase the cytokines. Now, when we were talking about the cytokine storm before, cytokines themselves are not bad. That's what first ramps up the immune system. Then there's other cytokines, and there's a moderation that settles it back down. So if you start the elderberry in that, as you're entering into that second phase, where now you're inflamed, that could again push some of the cytokines up too high. So this is something that I do prevention and at the early beginning, but I would not keep it going if things were going into the more severe secondary stages.
Okay, wonderful. Selenium.
Selenium is also, it's a very nice booster for the immune system. It's a wonderful antioxidant, quite safe to take unless you start eating lots of Brazil nuts, then you want to be cautious with that. But 100, 200 micrograms, 50 for kids. Just again, antioxidants. So, and let me explain a little bit about what, because we hear the word antioxidants. What does that mean? Okay. So when we get an infection, part of what we call the respiratory burst inside the cells, the original blast, okay, is the creation of oxidative stress. That's part of it. But too much oxidative stress damages cells, damages DNA. When we hear about free radical damage, that's what oxidative stress is causing. So we want to give things that, again, don't let that go too high. We want to give antioxidants to counteract oxidative stress that's caused by the infection or other things as well. So that's, again, the vitamin C, the selenium, the quercetin, again, is also an antioxidant. Those are things, again, to kind of keep things in the contain mode.
Okay. Well, David, this is wonderful. And I know that when I had it turned out to be, I was diagnosed with terminal cancer. I turned to David, and David said, build your immune system sky high. And I did, and I lived. So I know that these kinds of things are so critical, and the best time to start it is not when you have cancer, right? Or COVID. It's starting now, So, but if you do have respiratory symptoms, David, we now take a look, and people can read this on their own. But what we're looking at here is it's the same, but different dosages. Can you explain quickly, because we do want to get to some questions here?
Yeah, and so basically the idea is once you get sick, we need, when you're trying to keep the immune system and keep things in balance, it's one thing. But once you start to get sick, you basically need to pull out the heavier guns, is really what it comes down to. Okay. And so we rank it up for a little while, and then we bring it down back to the maintenance. And in our in my family, we may, and again, not from COVID, but during the cold and flu season, in that vitamin A blast that we were talking about for 2 days, we could potentially, during the cold and flu season, since let's face it, you can get 3 or 4 infections, we could be on it for 2 days, off of it for 5 days. Hey, something's tickling again. Let's start it for another 2 days. And that could go back and forth for weeks, if not a month or two, in our family for the immune system boosting. Okay. And again, all of these other supplements that you see here on the onset of symptoms, that's when we keep those other things going for a couple of weeks as well.
Okay. So David, before we get into questions, just curiosity, you've had some really serious problems with COVID in Florida. It's been a real hot spot. You have lots of patients, I'm guessing thousands of patients that are relying on you. How are your patients doing that are following this protocol? I mean, you can have patients that don't follow it, like going to Weight Watchers and stopping in McDonald's. Right, Jeannie? I mean, there are people that don't do protocols very well. You talk to them, but they don't follow it. For those people that are following the protocol, David, how are they doing with the protocol, and how are they doing?
It's a good question. Now, we have only had 5 people test positive in our practice since this started. Okay. Now, does that mean that there's only 5 people who got COVID? Were there people who had such minimal symptoms, or we hear about asymptomatic people that it never turns into anything? So I'm sure there are more than 5 people in our practice of 10,000 who have actually contracted this disease, but it never came to light. And this is not atypical for other viruses. So often I will hear in the community, rotavirus, which is a bad stomach bug that most kids get. Oh, rotavirus, it's so bad. I'm like, is it? I didn't even know we had rotavirus going around. I haven't heard about it. Or when the perfect one, when the H1N1 swine flu happened, it was the same thing. I was hearing from my colleagues, we're seeing 10 to 15 sick kids a day. We're putting 5 to 10 kids in the hospital a week. And I'm like, really? Because we only had 1 kid the entire flu season sick enough to actually come into the office to be assessed, and not a single person went to the hospital. And so I can't give you real numbers because, I know that I have patients who, and this is not what I advise, but I know I have patients who have taken to heart what I have said about building strong immune systems, and they feel that they are actually okay with going out and catching it. Now, that's what when you hear about natural herd immunity, that's what they're talking about. Not something that I'm advocating at this point, or I don't know if I ever will, but could an argument be made that if you're not around anybody with high risk, that getting it and letting it process like the flu is the most likely scenario? Yes. And at the same time, are we hearing about the one-offs of the completely healthy person who dies, which happens? So we don't know, what are those actual numbers? But I can just say that nobody has gotten to any level of concern whatsoever. And, granted, and is it because of all the stuff that we've been doing for all of this time with the checking of the vitamin D and zinc levels? Is it God's good graces? I'll take that too. But there's
So
something that's
how are the
clearly
five
different.
patients done, David? How are the five patients done that did catch
Oh,
it?
nobody got sick. I mean, like nothing. At the most, it was I mean, again, for the most part, it was a flu and a mild flu. Like
Okay.
nobody. And again, the take home message though for this should not be that I have created the way that guarantees that you won't get sick from COVID. Okay. I don't know that I have a large enough sample size to even start to proffer that. I can always share my anecdotal and my not anecdotal, my observational, and and the feedback that I'm getting from my two other providers, that it's just not, it just doesn't seem to be, at least within our patient population, it hasn't. But of course, I have no confidence that it won't happen tomorrow. We just don't know that. But we seem to have a pretty good track record going.
So again, I hate to say this, but it was so embarrassing going to the medical conferences, and David was the founder of the Medical Academy for Special Needs Doctors with me. He was so much better than anybody else at getting these kids better. I mean, Jeannie, these kids would actually lose their diagnosis with David after a couple of 3 years. It was remarkable. The problem is you can't duplicate what's in David's brain, but what he's sharing with us is of great value. Let's go to questions, and we will cut this off at 7:15, which is another 15, 20 minutes. But I do want to have people.
But I do want to spend a couple minutes talking about the vaccine and antibodies and those things within that. I think some questions, but I think there's some important information
Why
about
don't
that.
we take some questions, and why don't you end with that?
Sure,
so that
absolutely.
that in there, and I'll watch the time for you. By the way, I have a deep debt of gratitude for what you've done tonight. I know that it's just from the goodness of your heart. And by the way, I've never seen a physician that's done so much for people that have no money and he never charges them. David is just a remarkable soul, not only a good doctor, but a very good man. So thank you, David. And so let's have some questions. And this is a chance for you to say, what?
I have a quick question. David, what is your view of getting up until a person gets sick? I know if you start getting sick, you need to start doing things differently. But what is your perspective about getting the nutrition we need through food?
Yeah, and that's why I kind of skirted on that when we were talking about healthy food at the beginning. I could give a whole lecture on that alone. But again, foods are where we get our antioxidants and our vitamins from. Of course, quality of food, how much of those nutrients are in conventional compared to organic foods. Of course, that's an important thing. For some of the nutrients, like you can't really get enough vitamin D or zinc from food sources to get the levels up to where we find it needs to be. But again, coming back to, eating the foods that are the most calorically dense in order to provide ourselves, but that are not inflammatory. One of the common sayings amongst my colleagues is when you go into a supermarket, just stay to the periphery of the supermarket and don't go to the middle of the supermarket where all much more processed stuff is going on. But that's going to make a tremendous difference. And, variety of food. We talk about the colors of our fruits and vegetables, which each have different properties to them. That's a very important thing to our overall health. Absolutely.
David Chapaya, would it be too personal to ask you what effect eating this kind of great food did for you? I think you have to unmute.
There we go. No, I'd be happy to, because of David Humphrey's experience, I went on the Forks Over Knives program because it had been so effective for him and was part of what saved his life, I think. And I stayed on it for probably a year, and my numbers in terms of blood serum and things like that, PSA, cholesterol, all of it dropped precipitously. My doctor was astounded by it. I mean, it was numbers and reductions that he had never seen before. And he has 10 or 11,000 patients at his clinic. So, eating healthy, I'm sorry to say I didn't stay on it as close as I should have, but when I was on it, I never felt healthier, and my immune system had never been stronger. I mean, it was just miraculous, really.
Okay. Okay. Thank you so much, David. There's a lot of people that love to see you stay around too. You're a great man. So any other questions or comments?
David, I have one. This is John.
Hi,
Hi,
John.
John.
Vitamin D dissipates how fast in the body? I mean, we can add all this vitamin D, which I take 5,000 about every other day, David, but because I got my levels up, so I'm basically maintaining. But how fast does it dissipate in the body?
Slowly. Once you get the levels up, it's slowly. But I do find that you have to do a maintenance dose to keep it up. In fact, the reason why when we put somebody on a dose of vitamin D and then we follow up, we actually have to also wait 3 months to do the follow-up test because it does take that long for the blood level to equilibrate. So it's not in it. So in general, fat-soluble vitamins, which are the ADEK, A, D, E, and K, those are going to be more storage, and they store because they're lipophilic and they store within the cells. Whereas the B vitamins and the minerals, which are water soluble, they do leave the body much faster.
Okay. I have another question. It was my understanding in reading something today that there's a fatty covering around the COVID-19 gene or whatever it is. And the vaccines are attacking that fatty so that the gene can then kind of dissipate itself. Is that correct?
That's not my understanding.
Okay.
So the spikes, the little red spikes that we see on there, that is what penetrates. So that is a lipophilic substance. So that's how it can penetrate cells. Okay. This is actually a good segue because the vaccines that we're hearing about, the Moderna and the Pfizer, these are what are called messenger RNA, mRNA viruses. This has never been a vaccine type category that's ever been used in humans before, which of course is a reason, in my opinion, to take some pause for looking for unexpected consequences, because we do not know what happens when you inject messenger RNA into a bunch of people, what may happen in the longer term. Maybe
Right.
just fine. I'm not saying that it is or it is not, but that's again to it. But so what is happening? So most other vaccines, measles, mumps, rubella, chickenpox, they actually are putting in a whole virus cell that's inactivated into your system, and then your immune system is supposed to recognize it, create the memory antibodies, and then that's how that works. Other types of vaccines, like the pertussis vaccine, the Hib, Prevnar, influenza, not the live, that's a whole cell. But most of other vaccines, there's just particles of like the wall of, if it's a bacteria, or a part of the protein of that virus, that's what's being injected to again. This is what's happening with the messenger RNA, and it's quite fascinating. And I know that this is research that started off with fighting cancer cells. So the messenger RNA is what tells the body, or the replicating substance, however you want to be, to make that particular protein. Okay, so what they're doing is they are taking the RNA that codes for the spike protein, they're amplifying it. But when it goes into the body, the messenger RNA sees it, and then it starts making just the spike protein, but not the rest of the virus. But now there's all the spike protein here, and then the immune system can come in and mount the attack to those spike proteins. So that way, when you see if you were to see the virus in the wild state, you now have antibodies to that spike protein. So it's a very fascinating way that this is working, and who knows what this, maybe this will lead to other great discoveries here. But again, there's just a lot that we need to find out how our body is actually going to react to these substances. So as well, yeah.
That may have led you into your final disposition about vaccines, but I'm sorry if I.
No, that was kind of perfect.
Okay, other questions?
I have a question. Dave, if you're on this protocol, John, for any length of time, will it manifest itself in anything? I recognize if you take too much of something, you get diarrhea, but
right.
Will you feel better? Will you have signs that something's working or not working?
Okay, well, it depends on what we're looking for, because if you're a healthy person looking to stay healthy, you might not obviously feel something, okay? If you're somebody who has weakened immune system and you're getting sick often, then all of a sudden you're like, you know what? I haven't been sick in the last 3 months. I can't tell you the last time it's been 3 months that I've gotten sick with something. Now, granted, depending on how quarantining we're keeping ourselves, hopefully we're not catching anything these days. But again, that's where, the things that we're talking about of checking the levels for the vitamin D and the zinc in particular. I wish that I had more studies and data that I can rely upon. That's one of the unfortunate aspects of medical research in our country, is mostly going to be defined by who can patent something and make a buck. And so nobody's really researching to the level that we need to in large studies of vitamin C or echinacea or those types of things. So I am able to intuit from the last 20 plus years of experience. And again, I've had people doing these things for those levels of time and not had any of those problems. Now, would I keep a person on the arabinogalactan, the echinacea forever? No, I wouldn't. Would I do it during these next few months when this is probably going to be the worst spike of them all? You know, let's face it, by next winter time, the vaccine should be here that we had enough time to assess and see which ones that would be cool putting into our bodies. But for these next 2 to 3 months, that's where I'm kind of okay. And I'm not, again, this isn't a long-term thing. When the numbers were low, I wasn't suggesting that everybody start taking these things all over the place. But now that the numbers are ramping up, and there's obviously much, you know, when we're hearing about 130 to 180,000, I would not be surprised at all if by Thanksgiving we're seeing 250,000 new cases a day. I think it's if not by the end of the year, you know, so the likelihood that we could be exposed, again, depending on our behaviors, is different now. And so, but these are the same things that I've used every cold and flu season for the last 20 years in these exact same doses for this very purpose.
Good.
Yeah.
Okay, other questions? Thank you very much. Wonderful answer, by the way. Thank you, Tom, for the question.
Yeah, David, go
I
ahead.
have a question, David.
Yes.
What's David Berger's opinion on beta glucan?
For the purpose of what? Not something that's normally part of my regimen.
Immune building. Okay,
well, my understanding is that the arabinogalactan is actually is in the same family. I'm never one who tried to make up a story to make it sound good. I will say that this is not something that I have knowledge about, but I'm always happy to learn more.
Okay.
So, but yeah, and by all means, if you have something that you want me to assess, send it over to me.
I've been following these things for 40 years, so
yeah.
I'm familiar with everything you brought up. Little higher thresholds but if they can't hurt you, I figure it's a lot safer anyway. So I agree.
Yeah.
Well, Bill, you're doing a lot of things right. You're just a picture of health, and it's really a pleasure working with you. Roger, I think you had a question.
Yeah, hi, David. Is there any particular behavior that you should take on after you have a flu vaccination? I wanted to get some flu mist because I don't care for needles, but after 49, I hear that you can't get the flu mist and you have to have the quad something or other shot.
Right.
So,
okay.
What's your recommendation?
This is where I get to sound like a broken record. Okay. The supplements that we do for the first signs of illness happens to be the exact same supplements that I do leading up to and then for the few days after. So the only difference is, since we know that you're going to get a vaccine, the day before, the day of, and the day after, I do the 2 days of the 2 doses of the vitamin A, and all of those other high dose short term. I start from 3 days before and go to three days after. So it's a simple question. It's really the exact same thing, but also, you know, keeping healthy and not, you know, avoiding sugars and some of those other healthy dietary things that you don't bring too much inflammation to your body as well. But that would be that would really be the way that I would approach it.
Okay.
That I do approach it. Yeah.
Thank you. Joan, I can never remember being in a meeting with you where we haven't either had a question or a comment by you. So you'll have to unmute yourself, though, in order for us to hear you. Okay.
Okay, so what do you, how do you explain a person without never having had any vaccines, not getting the typical childhood diseases, measles, mumps, chickenpox?
Well, okay. Well, part of it is because of the fact that there is herd immunity for now. Okay. So let's face it, if most children get vaccinated,
this would be 1930s.
1930. So that would be very different. Okay. So, but again, there are people who get more or less severe cases of things, you know, and so again, how is a person's immune system? One thing we didn't talk much really at all about, which I also think is super important, mental health. That when we are in a proper mind space, when we're happy, when we're not in anxious, depressed, panic mode, because of what that does to our adrenal glands as well, and the effects that that has on the immune system. So I do believe mindfulness practices, meditations, and yoga of those sites, I think do also have a really important role in keeping that inflammation down as well. Okay, but why one person versus not another? Again, what you're exposed to versus is how your immune system fights it off. I mean, most people who got polio in the world didn't become paralyzed. The most people who got polio, it was a stomach bug. Okay, I mean, so obviously, what made the people go into an iron lung? You know, it was a fraction of the people who actually got the disease. So, you know, and another thing which we really didn't talk about is our own genetics. The genetics that code for our immune system and our inflammatory system. And so, again, we haven't talked about things like MTHFR and methylation genetics. That's a whole nother lecture in and of itself. But the way that our immune system responds is partly based upon our nutrition and stress and the inflammation around us, but also how does our body build its proteins of immunity, which is based upon our genetic code. So that's why, you know, you hear, for instance, autoimmune diseases will run through a family, right? Often it runs down the woman's side of the family. It's more likely that happens. Okay, that's genetic. So I'm sure that there are people whose immune systems, I mean, like, case in point, what are we hearing now about COVID? Blood type O is protective, right? Something as simple as that. And that seems to be a very protective thing again for people for getting serious disease, just because of your blood type. So I would certainly imagine that there's other things that we haven't discovered yet. And maybe there was a similar type of thing for blood type O and measles, or maybe it was A for that one. Again, lots of theoreticals there, but we're all not clones genetically, and we all have different lifestyles and how we take care of ourselves and the stress around us. And that that's the reason why I spell holistic with a W. You got to look at the whole picture. You can't just micro focus on one thing. And, you know, I remember so much in my medical school, the cardiologist would come in and say, "Oh, the heart's the most important part of the body. If you don't pump blood to every part of the body, you're not going to get pumped blood to the brain, and then you die." And then the neurologist would come and say, "The brain's the most important part of the body because if you don't have that neurological function, you're just going to die." And then the immunologist comes in and says, "Well, the immune system's most important." And the GI doctor, "If you don't get your nutrition." And I'm watching these characters one at a time, and I'm thinking, do you guys never talk to each other? You realize we're talking about the same individual human body form that we're talking about here, and you're all talking as if yours is the latest, greatest of things, and maybe we kind of need to take all of that in together. And so that would have been in 1993 or 92 when I came up to that. We're looking at this wrong. You know, I mean, you have to look at the whole picture in order to get all of this stuff in there. And so that was kind of like another formative moment of like how I kind of started going these directions.
Okay, I knew Joan would trigger off a very interesting discussion. She always does. So thank you, Joan. I'm going to have to call on Marcia to have her unmute herself just so we can see what Marcia's thinking about all this stuff.
I'm like sitting back in awe. So, I mean, I really am. I can't believe that you would take the time to do all this for all of us, because it's a major concern what's going on in the questions and everything. Your knowledge is unsurpassed. I mean, it really is. So I'm kind of taken back on all of this. Let me ask you just a really simple question.
Sure.
And it's something that has been circulating within the family and business and everything. Mass. What is the best mass? There's so many pretty ones, but
I called on you to get the mask question. If you didn't,
I couldn't believe it. I thought Victoria would do it.
Okay. All right, David, you're on the spot on masks.
Okay. So the best way of knowing, there's two aspects of it. Number one, how is it fitting on your face? Is it, is it touching the sides of the face down here? How much, because if it's not, let's say if the sides are open a little bit, then it's just causing air to go that way, right? But if it's catched here, then it's kept, then from a protection perspective, it's contained. So having a properly fit wired rim so that it stays on your nose. Okay. How many people do we see wearing a chin bra? So having it covering the nose and the mouth and the stuff that we hear about, that's important. Bandanas do not give the same type of doesn't give any of that restriction. And even neck gaiters, they're too thin. So the best way overall of knowing if your mask is effective is simply take a bright flashlight or the light from your phone, shine it through it from the other side. If the mask becomes translucent, that's fine. If you're seeing the actual threads coming through and the light going through the thread, so it kind of looks like a planetarium, if the light's coming through, that means that the weave is not tight enough, and that means that aerosols can pass through. So it's called the light test, and that's the best way of knowing that your mask is going to provide the level of filtration necessary.
Thank you. That's a simple way to do it.
Great,
So
great
simple.
answer. We only have 3 minutes left, so let's see if we get a couple of more questions in from people that haven't shared. I'd love to get a question from David Trinks, because he's I don't know whether he's brighter than you are, David, but he's pretty close. So David, are you still with us? We may have to have left. So anyway, any other questions in the group? Let's see if we can get another couple of questions in.
How about children? Children seem to be fairly immune, at least of very serious cases. What's the explanation for that?
I think it's a combination of two things. Number one, because kids do not have worn out immune systems, their ability to keep inflammation as a whole. Kids rarely get autoimmune diseases, cancers, other things relative to how often adults do. So a primed young immune system, just like I guess with everything of youth, is part of that. But here's the other thing. The common cold that we were talking about, all the other coronaviruses that are out there, they all have that spike protein. So it's felt that also that the kids who have had the common colds, and they're more likely, because let's face it, they're germ pools when they're in school, but that's part of the building immune system. Whereas older people who aren't around kids as much aren't getting exposed to those common colds. And so they probably have some some carrying around immunity. As a pediatrician, I have the solid immune system, but I've been around sick kids and coronaviruses for so long. I mean, I probably, especially because my vitamin D levels and zinc, I'm not willing to take my chance in going out and giving myself natural coronavirus. But do I honestly think that I'm not going to be one of the percentage of people who perishes and that our body will do fine? Yeah, just because of everything that I do and what I know, but I'm not willing to take that chance because you never know. But I think that having that stronger immune system because of what you've been exposed to, and more recently as opposed to less, because immunity does wane over time, that's important. And so I actually do want to close also, though, on something that we haven't talked about yet, which I think is going to be a very big part of our future. Okay. We've been hearing a lot about the types of testing, and there's the rapid testing, and then there's the PCR testing, which takes longer but more accurate. Occasionally, though not often, are we hearing about the second part of this thing, which are the testing for antibodies specific against coronavirus. Since there are people who are asymptomatic and didn't know they have it, you could actually do an antibody test, an IgG titer, which is the same thing that they're doing to test and see that it's working in the first place. And the same way that we're able to know that people are protected against measles, mumps, rubella, etc., is to see, do you have protection already for the coronavirus because you were potentially exposed? Why would that be important? Just in terms of what your behaviors will be, but also in the risk versus benefit question about a vaccine. If you've had the virus and you're immune, then the benefit for that vaccine significantly goes down if it's not going to provide protection for you because you have protection already. So we're not just being laissez-faire about it. So that could be a potential question, or maybe that would be a good way of determining, since they're going to have to ration the vaccine, they can't give everybody all at once. Potentially the people who already have some immunity would be the people that could be postponed later on. Maybe it turns out, though, and this is where this type of test comes in so spectacularly, but also we hear about, how long does the protection last for, right? We know it's been at least 4 months, 5 months. The reason why we don't know longer, it hasn't been around that long. But wouldn't you like to know if I'm protected today because I had COVID or I was asymptomatic back then, if I'm protected today, wouldn't it be nice to know if I'm protected 2 months from now, 4 months from now, 6 months from now? Yeah. And if I can just do a finger stick and do a blood test in order to tell me that'd be great. Even more so, how do I know that the vaccine worked for me? If we're hearing that it's 90% successful, that means it's 10% fail. Well, if you were getting a vaccine and you were going to then potentially be more comfortable going out in public because you think that you're protected, wouldn't you love to know that vaccine actually worked for you? You know, so I see this IgG testing and the ability to do it through just a rapid finger stick. You don't have to do it in the vein. So you put on a dry blood spot, you send it into the laboratory. That could be a really, really helpful way of society getting through this and minimizing the spread.
One caveat to that, I had COVID in February and I tested and I had the antibody in March, April, May. In June, it went away. So it's in the blood serum, it is no longer present. So the question is it there and just not disclosing itself?
Right.
Or is the immunity 4 to 5 months?
Right. Have you repeated it? Since you had the negative test?
Not after June. I did it twice in June and I didn't.
You might want to, again, there's lab error, there's all the types of things you might want to just check about that. But that's my whole point of why this antibody test would be such a critical extra aid for everybody to know. Okay.
Oh, yeah.
Because so
But
that I'm really high on this.
So David, we're at the end of our time. I have to tell you, I am so greatly honored to call you my friend. And I thank you so much because the people that are here tonight are all the people I love and care about. So I have this recorded. So if some of you would like to hear it again or send it to a friend, we're in the business of saving lives. Thank you very much. And thank you, everybody.
And if anybody does want more help on this, I do like via telehealth. I set up what are called educational consultations. So I'm not actually serving as your doctor since I'm not licensed in your state. But I can go through you, I can interpret laboratories. Can share with you, well, this is what I would do in a person who has a similar lab results with your particular health condition. And that's how I'm not providing direct medical care to somebody. So that's also a service that I'm able to provide for people if you feel it's the need to dig more.
Well,
Good. Thank you.
thank you so much, David. This was also tons of fun. Thank you.
Yeah.
Everybody.
Thank you,
That was
David.
great. Thank you.
Thanks, David.
Have a great day, everybody.
Good to
Have
see
a happy
you.
holiday season.
Thank you.